In today's video, we will be talking about why I chose not to become a pediatric nurse practitioner, even though I dearly loved working in pediatrics. I'll give you some things to think about if you're thinking of going into being a PNP. Also, I just want to say this video is in no way discouraging you from being a pediatric nurse practitioner or a pediatric care provider in general. It's just to shed some light on some things that to me were things I was like, oh no, thank you. But to you, you might be like, I'm all about it. Just some insight into the profession in general, if this is something that you are looking into. If you're new here, welcome. I'm Liz. I am a family nurse practitioner. And like I said, I worked for many, many years as a pediatric nurse and I loved it. So when I decided to become an FNP and work mostly with adults in family medicine, a lot of people were like, but why didn't you go to peds? Because you loved peds. And I was like, yes, I do love peds. So I thought I would just make a video about it and explain kind of the different things that went into my decision behind that. And again, it's a great career. Hopefully this can kind of give you some insight to know, like, would it be a great career for you? Or maybe you want to venture off into other lands like I did. And I think as we're going along, I'm gonna, at the end of the video, list some things that I miss and I wish I had more of and that I really miss about pediatrics, because as I'm going down this list, I'm like, man, I'm making this sound terrible, but there are so many awesome things about peds. We'll just put them at the end so we end on a happier note. So one of the biggest things I think that influenced this decision was I love children and I love working with children and primary care. And I knew I wanted to work in primary care. That's the other part of it, is I was very primary care focused. So I knew when I was going back to NP school, I have a whole video about why I decided to become a family nurse practitioner and leave the bedside, and I will leave that up here in case you're interested and in the description below. But I knew I wanted primary care. So that would either be like pediatric primary care or family medicine primary care. And I love, like I said, children. And when I worked in the hospital, I got to work with kids so much. Obviously their parents were there and they were very involved, but you were taking care of the child, the patient. Yes, there was a lot of education with the parents and so much interaction with them, but you really did have a lot of interaction with the kid because they were your responsibility while you were their nurse. In outpatient pediatrics, yes, your patient is the child. However, most of the communication is with the parent. You're asking the parent all the questions. You're asking the parent, are they doing this? Are they doing this? How are they hitting these milestones? You're answering all the parents' questions. It is much more parent guided. You're talking much more with the parent. So yes, you are dealing with the child because they're still the patient, but a lot of the interaction is with the parent. And that part, in general is fine. I really love educating. I love answering questions. I love doing all of that type of stuff. But when I was looking into this and more exploring this role and talking to other people who worked in peds, some of them were very honest and they were like, I think you may get frustrated just with the type of questions. And after really looking into myself, I was like, I think you might get right. And here's what I mean about that. Pediatrics is a lot of parent questions, parent concerns. And some of those might sometimes, and this is in no way, because this is the way I am with my kids too, like everything I think is like the end of the world. And I'm just gonna be really honest here. A lot of it is like, oh my gosh, they coughed once, and you bring them in. And I just do not have the patience level to be like, you brought them in because they coughed once. Like that would be my face. And that's inappropriate. Parents deserve to have a pediatrician who's like, oh, like, let me look at them. This could be like, let's look at them and see what's going on. Not like, are you kidding me? Because that's inappropriate. It's also why I could never do labor and delivery. I'd be like, of course labor hurts. Let's go. What did you expect? But children and their parents deserve someone who is willing to take every little concern, like, ooh, look at this. Like, what do you think this tiny bump is? What do you think this cough is? Like, ooh, she sneezed twice, like in the same day. Is that okay? And that's just what a lot of peds is, because they're your precious babies and you love them. And if you go into peds, you just have to be okay with that like parents are going to, it's their most precious person, and they're going to protect it fiercely and ask questions and hopefully advocate. So that is what I love about parents, but a huge reason why I couldn't go into peds, because I would just be driven off the wall. And that's just being really honest. Another thing is the opposite end of that spectrum. Parents who aren't advocating, aren't asking the questions, and just don't really care. That would make me angry, break my heart, and possibly get me in trouble. Working in peds in the hospital, you saw a lot of cases, just sad things. Parents who would drop their kids off and be like, all right, call me when they're done, like as if they were a microwave meal, and like leave. And other cases you saw obviously a lot of abuse. You saw a lot of social situations that were very sad. And that was very hard. And I think honestly, long-term, that would have really even affected me in working inpatient, was just seeing that over and over again. Fortunately, inpatient, that was not the majority. And I know outpatient, that wouldn't be the majority, but to have to see parents outpatient who were, not brushing their kids' teeth, not caring what they ate, who are not really instilling a lot of great behaviors into their children, who just don't care, to be honest, that would just break my heart. Other things that that would just break my heart would be parents who cannot provide what they would like to for their child. That is heartbreaking. And that aspect, like, I just knew I cannot deal with that for right now. I cannot handle seeing children not being given the life that I wish they had. It's something I can recognize in myself and say, I can't do that. For some reason with me, it's still heartbreaking when I see adults not being able to have that. But in adults, it's a little bit different because a lot of the times it's heartbreaking when they want to make the choices. They just changes or lifestyles, but they can't afford it. That is equally heartbreaking. But an adult has choice, like an adult has free will. So their choices are, like, hey, if you want to go and eat a bag of cotton candy every day, like, that is your choice. It's not your parent handing it to you and letting you make that choice, if that makes sense. So I knew I couldn't handle that. So that's something you have to think about. Are you someone who is, obviously you can be such a force of change in those children's lives and like find resources for them and advocate for them when their parent is not necessarily. I just know I didn't. So if you feel like you could do that, that would be a phenomenal thing. And then the last, like the abuse thing too, that just, I knew how is that not troubling? I knew how much that affected me when I worked inpatient, when you had patients who would come in and they were a non-accidental trauma. And I knew I could not handle that in an outpatient setting. I would probably like get arrested or something. Like the rage that I feel would not be appropriate. That's not helpful. It's not helpful for me to get rageful or that furious to where I can't like work with the family and get what needs to happen. So that's something I just knew about myself. And if you feel like you could be a source of change in that child's life and their trajectory and that family in general in a situation like that, then for sure think about it. I just knew in myself that I could not. The next thing I knew I didn't want to do is I didn't want to do the vaccine battle, which I kind of feel cowardly admitting. I am pro-vaccine. I think they save lives. And as we've kind of entered this anti-vax movement, I can have those conversations with my pediatric patients when I get them, because I still do see peds. I do see children, just a lot less of them. I can have those conversations here and there, but I feel like if I was having them all the time, that might make me irritable about it. And I never want to enter that conversation in a battle, aggravated way. I truly feel that education and just calm, like rational conversation is the best way to go about that. And I knew that if I was having that conversation almost every day, I wouldn't be in the best place. I wouldn't be serving my patients well because I wouldn't be in the best mental place about it, to be honest. I'm much in a better place about it when I talk about it with my adults and when I talk about with the kids I do take care of, because I don't have it all the day and I'm not tired, to be honest. So if you feel like you have a lot of patience in that area and a passion to educate about that topic, this would be a phenomenal place to come and work and go into. But again, I highly encourage you to come into it with an open mind and understanding that parents are coming from at it. They're scared, and fear is a powerful thing. So don't go into battle, just go in for a conversation and be willing to do that. I know I can't do that day in and day out. So here we are. I work with 50-year-olds a lot. Another not totally related to peds thing that I chose to not go into peds for was, if you watch that video on why I became an FNP, I fell in love with educating and preventing illness and really like empowering the patient, which is absolutely present. I think patient empowerment starts at a very young age, educating your patient and their family about healthy lifestyle, all of that. But I really love it with the patient, and you really can't have that conversation with a 5-year-old very well. So that's more of like a teenage years. And I see a lot of teenagers in my current practice as an FNP. So I think that component would have just been missing. Not that you can't educate parents, all of that, but just what I fell in love with about being an NP tends to fit more into an older population. But absolutely PNPs can provide awesome education, all of that. A lot of that is just geared towards the parent until the kid gets just a little bit older and can talk and understand conversation and decide things for themselves. That's the other huge thing. You need a little bit of autonomy to really have that patient education and understanding. And those are pretty much the biggest reasons why I didn't end up going in to become a PNP. Honestly, the major things, in case you haven't like read that thread through here, are the parents. I love children dearly, like I said, and I love adults, like interacting with them as the patients. But when adults turn into parents and like interacting with them in parent mode, I wouldn't want to interact with me in parent mode. Like, it's kind of annoying. Obviously, it's wonderful. You want them to be mama and papa bears and like advocating for their kid left and right, but it can be kind of hard if you're on the other end of that. So there's a lot of panic, a lot of just concerns, which there should be, and I'm so glad there are, like I said. But that is just, I like kids, not necessarily their parents, and that is why, in a nutshell. So if you like kids and their parents, this is perfect for you. Now let's talk about some things that are phenomenal about PNP, like primary care pediatrics, any kind of outpatient, or just peds in general, because I feel like I just like poo-pooed on everything, but I love this profession, and sometimes I do desperately like question all of my choices. I'm like, maybe I could handle it. Maybe I would be fine because I love them. Number one is obviously kids. You get to see kids all the time, and kids are just so energetic, so full of life, so funny. Like, while you are dealing a lot with the parents, you're dealing with the kid too, and they are just like resilient, like great little humans who bring joy to your day. It was so joyful. Even working in the hospital, those kids just like brought joy. They're resilient. They get better so much quicker. They have so much drive. They're like, I will stand up with 4 chest tubes and march down this hallway, so help me. You're just like, no adult. Like, adults come in, they're like, I stubbed my toe. And I feel like kids are like, I feel like I can't breathe. My oxygen's like 52%, but like, I'm sure I'm fine. Like, you know what I mean? Like, they're just like really hardcore little people, and I miss them. Second thing is all the parent education. Like, parents, if they're engaged, like only want to be educated about their kid. They want to know all the things. What a phenomenal opportunity. If you love educating and you have a little bit more patience than I do, this is a phenomenal place to just lay on the education, answer some questions, and set, you know, there's a lot of like, with the internet and like Facebook groups, like there's just so much interesting and fake information and floating around out there, you know, and you could like set some of that straight and be like, no, actually, do not melt candles into your ears. That will not help with ear infections. Please don't do this. It will just check, like, that is not safe. You know, you could be that voice of reason in their life. Next is you just get to like watch them grow up. How cool. I have a few kids now that I have been working with, and I'm really glad I still get to see kids because I've like watched them like grow. I've only been in practice a little under 2 years, but even like 2 years in a 3 to 5 year old is huge. Like, how cool is that? And if you work there a long time, you could literally see them grow up. Like, that is just mind blowing and awesome. And you could be such a resource to them when they're little. And then as they become an adolescent and they feel like they can trust you and ask you all those questions, and just so cool. In case you can't tell, like I'm like, that's the thing that I question my life choices about. I'm like, that would be so neat. And last is just like, peds is just usually hopeful most of the time, unless it's not, and then it's really, really hard. Most of the time they get better. Most of the time they do well. There is more of a sense of hope and wellness, I think, in pediatrics than other populations I have worked in. And that is just something unique to that place and those people. And I love that about it. You have such, if you're looking to go in to be a PNP, there is, or just in pediatrics in general. And if you have any questions about like working in peds or anything, I do have a video like tips for working in peds. I'll leave that link down below as well. But peds is just such a cool area where you can make such a difference. You're like helping mold this person. You are the parents' go-to as they help mold this person. You can be an advocate in the times when someone is not molding that human, or they're just like being a bad influence in that kid's life. They're hurting them. They're causing harm. They're not doing the best. You can help provide them with resources or intervene if you need to make sure that that kid gets the best care that they need. You have such power over that situation. And I just think that is so, so cool. So if the cons didn't really sound like cons to you and the pros, you were like, I'm all about that, I'm so excited for you because peds is such a cool area. And if like the thought of having to talk about menopause with your patients makes you just want to like vomit, there's this for you. They're here for you. Very, very few 3-year-olds go through menopause. So this will be a safe area for you. If you have any questions or other things or your experiences with it, what you liked about peds, what you didn't, why you chose kind of what you did, leave them down below. Any other questions? If you guys do this, if you're a pediatric nurse practitioner, you work in peds, If you answer any of them, any of that, like just chat in the comments because we gain so much insight from each other. Hopefully this cleared up a little bit if you've watched my channel before and you're like, why? I don't get it. Like loved peds, still like always say you loved peds and then didn't go into peds. Hopefully this kind of bridged the gap for you and gave you some insight into my decision. And you learned that I'm just impatient and have too many feelings sometimes to go into this. But thanks so much for watching. Hopefully you gained a little bit of insight into maybe if you're considering this career path. Hope you have a fabulous rest of your day and I'll see you next time. Bye guys.